So implants themselves, because they are man-made, there always is that risk of manufacturing defect in the short term, and in the long term, things such as rupture. The risk of rupture is quite low according to each manufacturer. Specific numbers can be provided because it does change, but they're usually on the order of about 0.01% per implant per year, quite a low rate. So what that means is, if there is a rupture, most manufacturers will replace the implants without any charge. Some manufacturers will have an extensive guarantee or warranty, and it is important to check with specific manufacturers to decide which one would be best for yourself. I think the important thing with rupture is high risk activities are things where the implants are potentially put at risk of direct rupture. So direct blows, high impact sports or car accidents, something where it's really going to be a high energy impact to that implant obviously puts it at a higher risk. Doesn't mean you have to walk around in cotton wadding and protect them all the time. Quite the opposite. They are actually built quite well, and you can really give most implants a reasonable amount of force before they actually rupture. In fact, I think the recent biomedical tests show that the amount of force to rupture an implant would actually rupture ribs. So your actual ribs would break before the implants would actually rupture, which is gruesome, but it's just to give you an idea of how extensive that pressure is. So in terms of things like rotation, implants that are not meant to rotate shouldn't rotate. So anatomical implants really shouldn't be rotating at all. If they do rotate, there's a problem, and that can be fixed. Round implants, if they do rotate a little bit, it doesn't really matter so much, simply because they're a circle, and because of that, it doesn't really matter if they rotate. Rotating implants can be an issue if there's a major asymmetry between the left side and the right side. So I would consider rotation to be a problem if it's palpable. It really, patients can feel it. If you look at it and say there's an obvious difference between a left breast and a right breast, then really something should be done in that sort of circumstance. There's usually no risk to someone's health if an implant ruptures or rotates. It really is more of an aesthetic issue. Implant rupture is a worry. The good thing with the new generation and current generation of implants are that the cohesive gel doesn't leak like a liquid. Very old style manufactured implants had a liquid silicone that was present within the implant itself. When that implant ruptured, or if it ruptured, that liquid silicone could potentially get into the surrounding tissues, and that's when it was a real problem, because it can cause a lot of damage to the surrounding tissues. Whereas the new style cohesive gel, if those implants are cut or ruptured, they don't leak because they're cohesive, meaning they actually stick together like a gummy bear. So you can cut a gummy bear, try and squeeze them, they just stay in the shape that they're in. The big hot topic right now is something called ALCL, which is an anaplastic large cell lymphoma. There is not one particular manufacturer that is implicated in that. It's a style of implant called a macro-textured implant. What that macro-texturing is you can sort of see and feel the texturing. The current thought behind the reason why that happens has to do with the implant picking up bacteria as it's put into the pocket under the muscle or above the muscle. If due care is taken by the surgeon to prevent that implant from touching the skin, picking up the bacteria, the surgical technique is clean, we're not damaging the surrounding tissues, and being very gentle and being relatively efficient with the operation process, then generally the risks of having something like an ALCL are very, very low. The reason for that is that you're not picking up bacteria, the wounds heal up quite quickly, and that risk is significantly lower. Current data also suggests that the biggest risk is, in fact, surgical technique and not paying attention to all the risks that can potentially pick up bacteria along the way. So there's a 14-point plan set up by one of the manufacturers that suggest being protective of the skin, protective of the implant, changing gloves, using antibiotics, betadine dips, etc., etc. As a general rule, I would follow all those 14-point plans regardless of the manufacturing implant, because that's good practice. It's something everybody should be doing if you're putting in implants, because it's the appropriate thing to be doing. So ALCL, as I say, at this stage is not one manufacturer that's the problem. It's a complication of having that macro texturing on the implant as a result of poor technique and not bearing in mind that potentially those bacteria that get picked up can actually long-term cause a problem around the implant.